a great day, I'm feeling good. Oh, the possibilities of what I could.
What happens when a blind man, a woman of color, and a child of immigrants get together to discuss how diversity, inclusion, and equity affect your business?
Hi everybody, welcome to the Choose Inclusion podcast. I'm UB and I am the Latino white guy of the group.
I'm Neena. I am the woman of color in the group.
And I'm Mike. I'm the blind guy.
Hello, everyone. Welcome back to another episode of Choose Inclusion. Today, we are doing an early morning recording, but it sounds like everyone is in good spirits. So let me say hi to my co-host, UB and Mike. How are you guys doing?
Doing good. Fantastic. Thank you, Neena.
Awesome. So we have an amazing guest today. Neena Patil is an Asian American C-suite executive on a mission to create a corporate culture that supports all employees to do their best work. So Neena is the general counsel at Jazz Pharmaceuticals. She oversees board member stakeholder relations, workplace culture, diversity and inclusion initiatives, all while juggling her role as a mother. We are super excited to have you here today, Neena. We have two Neenas on the podcast, so we're gonna do our best to try and not confuse both of us. But Neena, how are you today?
Good morning. Hi, Neena, Ubi, and Mike. Great to see you and to be here with you. Doing great this morning. It's a Friday before a long weekend, and great to be here.
Yeah, so let's just go ahead and jump right into it. You are the only person of color on the leadership team at Jazz Pharmaceuticals. Can you tell us a little bit about kind of what is your role there, and what are your experiences kind of being the only person of color at Jazz?
Great, Neena. I think it's an interesting position to be in. When I chose to join the company, I was coming to a company that was committed to two really important things, and it was important to me that I shared the values and the focus of the company. And those two things were building and continuing to have a really strong culture and making it really the best place to work for our employees. And it was also having impact on patients and our community where we work and where we serve. And so that was compelling to me. And the fact that my joining of the company was based on a real focus on diversifying the leadership, committing to both gender, ethnic, racial, and other elements of diversity within our leadership was really, I thought, a great opportunity for me. I am, one of many leaders at the company that are committed to diversity, equity, inclusion, and really, it's a great opportunity, I feel, to be in the C-suite and being able to influence in my role.
I love it. Thank you so much, Neena. We are truly honored to have you on. In your intro, I don't think you have nearly enough hats. So for you to carve out a little part-time hat and be a guest on our podcast, we really appreciate that. But okay, so where the rubber meets the road, like I love hearing the talk of C-suite team members being all in. Can you give us some practical, tactical, like what are you and your team doing to actually help your organization truly feel like it is embracing all forms of diversity?
So, for the company, it was, and it started with really acknowledging where we are. And that is acknowledging that we're not necessarily where we want to be when it comes to creating the most inclusive environment and having belonging among a diverse set of employees. And so, we start with the journey of observing and learning, and that's very much an iterative journey, right? You observe and you learn and you take steps and you act, and then you do it again and you do it again. And so for us, it has been a lot of dialoguing as a large group, talking in smaller groups, pulling in insights from our teams and from employees who are courageous enough to talk to us about it. It's not easy, and it's really been really amazing for me to be able to see where some of my colleagues are learning about their history and their experiences, and how it's made them and shaped them, as far as who they are today. But this willingness to continue to learn and grow. And so that's where we are now. We are putting, kind of ourselves in a position now where we know what can have the most impact for us in this moment. And so, excited to be rolling out some initiatives as it relates to bringing a diverse group of colleagues together to help us with business challenges and business priorities, and again, modeling what we hope to continue to build and grow in the company.
And how does that work sort of mirror the work you all are trying to do? And let's start with the pandemic, because I think one thing that has become abundantly clear during COVID is sort of these health disparities that exist between different types of communities, right? And it seems to be impacting, or it is impacting, communities of color and different minority groups much harder than it is, the white community. So how do you balance that, the work that you're doing internally, but also the work that you're doing externally with with these different types of communities? Like, what does that look like? How does that work?
Yeah. So, we obviously, when COVID, really kind of came to be for all of us earlier this year, we had really, in addition to our business, and so I'll kind of put the business, just the day-to-day operations of the business to the side for a minute, because of course business continuity is something that all companies, right, jumped right into. We focused on three groups of stakeholders: our employees, our communities, and our patients, and really thought through what is the impact on those groups, and how can we do our part to help and support them. And so, obviously for our employees, it looked very different. It was all about creating an environment where we were caring for our employees. We were taking care of their health and their well-being, as well as their mental health and security, but also ensuring that they had what they needed to continue to be productive and also meet the commitments of their families and those around them. In our communities, it was really looking at where the needs are, addressing not just health-related elements directly, but thinking about things like food insecurity and how we can help and support there. We were in a unique position to have facilities in the northern part of Italy, and so we were a company who, maybe more quickly than companies that operate solely in the United States or maybe in other regions, we appreciated the impact that COVID was having across communities, and even in that setting started to understand the disproportionate impact of certain parts of the community, just hearing that from our colleagues in Italy. So we understood that, and so we were kind of primed to really think through how we wanted to be responsive there. And then of course with our patients, it was the same thing, in that we wanted to make sure that we were ensuring that patients continue to have access to really life-saving medications that were really important to their health and well-being. But within that, also starting to observe, right, that there were groups of patients where that might be harder to ensure that continuity. We had ongoing clinical trials that we wanted to ensure we could continue to serve those patients, and again, understanding the challenges, right, for those who need to transport themselves or live farther away. Or alternatively, that were in other situations where they needed support outside of simply just the medication or the treatment that we provide. So it really was understanding pretty quickly. But we, like everyone else, really started to observe and really note the trends around the disproportionate impact that COVID was starting to have on certain populations, Black and Brown Americans, and in particular, and our urban centers, and how that was manifesting itself. And it really was something that coming from a public health background and understanding some of those factors and the determinants of health, really shouldn't be surprising, but it was really eye-opening to see that, and to really think about what that means for us, and how we want to, going forward, respond to that.
So you just kind of touched on clinical trials a little bit, and from our previous conversation, I was really fascinated about what kind of how do pharma companies address the health disparities. And I love that you're looking at the social determinants of health. Like, it's not just healthcare, but like housing and access to food and all of that stuff. But one of the things that pharma companies need to do in order to get a drug to market is do clinical trials, right? And can you talk to us a little bit about what's happening with clinical trials as it relates to communities of color? What does that impact mean, and kind of what we need to see happen to change it?
Yeah, so I mean, it all starts with the products and the drugs, in our case, that we're developing. And so you study, I mean, the way it works, right? You study drugs in certain populations, and that leads to data that companies, sponsors generate, and ultimately support getting products to market. And so it is the case that if you continue to study drugs in only certain populations, that those populations tend to be the ones that gain access to those products, and certainly where the outcomes that are assessed really to address their health needs. And so creating broader access to clinical trials is extremely important. It's one of the first steps, as companies, that we can do to ensure health equity ultimately in our space. And so, where you, how you design a trial, it starts with that, right? So you can imagine that there are certain populations where and I mentioned this before, transporting themselves and getting to a clinic or getting to a hospital, to either get the treatment, or oftentimes during clinical trials to get assessed in between cycles, can be really challenging. If someone does not live close to an academic medical center, which are typically in more urban or suburban areas, that's long distance travel that oftentimes requires them to rely on other people and have private transportation. So it sounds really in some sense simple, but it can be challenging. And so to really design how you assess health throughout a clinical trial becomes a really critical part to ensuring broad access to those studies and treatment, and ultimately care. And so there are ways to do that. It's certainly, with technology now, we have such amazing ways to track health data, and for people to do their own assessments in their homes. And with crises breed innovation comes, right? And so we're even seeing in the last several months startup companies forming to help fill the void where in the world of COVID, folks were in their homes, were not able to leave their homes. We have oncology products. Certainly, people suffering from cancer are more susceptible and had more risk of COVID. And so they were typically staying home. Clinics were not encouraging their patients to come in if they didn't have to. Procedures were treated as elective, and therefore were not prioritized. But there are companies forming out there that are actually creating ways to provide almost inpatient care to people in their homes. And that opens up a whole world of opportunity when it comes to clinical trials in particular, Neena, which is your question, but also ultimately how we care for patients. But accessing technology and innovation that allows us to change where treatment can occur, mobile treatment centers, right? Bringing the care to patients. That will allow us to broaden who we include in clinical trials and ultimately who gets the benefit of the innovation that we're focused on.
Going back to the first question that Mike asked about diversity in the organization, something I always find fascinating is, and this goes for a lot of things, and one of the things we always talk about is, if candidates can't see themselves represented in the organization they're applying for, then they can't see themselves actually belonging there, right, and being successful there. So kind of in that tone, how do you, because it's for like mental health, for health in general, I always feel like patients of color and minority groups who can't see themselves represented in the health workers who are trying to help them, it creates a distance there, or why there isn't an opportunity there isn't a lot of kind of counseling and therapy opportunity for people of color, because there aren't a lot of people of color in that profession.
Yeah.
How so is that part of the conversation as well, like as you try to diversify the organization and the help, and working with more diverse organizations, for example, is that part of the conversation?
Yes, it is, and I think it should be more of the conversation, right? I mean, we're not
Right.
we're not closed systems, right? So a company, it's not just about what we do within the walls of our organization. And in fact, I'm, increasingly becoming more passionate about and a proponent of really what's happening in the public spaces, right? Where how organizations can kind of collaborate with each other and think about the bigger systemic changes that we want to make together, right? If we kind of pool our energy and pool our resources together. So absolutely the case that we can, to your point, Yubi, really focus on trying to recruit diverse talent into roles, whether it's on the scientific side or in different parts of the organization for Jazz, but also as you talk about the healthcare system, for providers, right, to really encourage that through their recruiting. But if you don't have the candidates or the folks that have had the opportunity to develop the skills to be available for those roles, then it's going to become a very challenging thing, right? So I think it's twofold. It's really thinking about how we create roles to really encourage and foster diverse candidates to put their hat in the ring and to be eligible to take on those roles, right? Not adding extra degrees for a role that aren't necessarily critical for someone to do that role really well. But it's also thinking about what's happening around you. So, take my, an example for me where the legal profession, like many, have not been really great about diversity in all cases. And so there are a lot of initiatives, and we're part of an organization called the Leadership Council for Legal Diversity, where we really are focused on, through law firms and in-house legal departments, supporting diverse law students through mentorship and other programs, as well as folks in legal organizations to help support the diverse lawyers to help support their development. So you have to really invest in all sides of that in order to ensure that, to your point, someone sees themselves, right, in the people around them, in roles and opportunities that they aspire to have themselves. And that goes for someone like me, right? I mean, it's often the case, as you all started the podcast mentioning, right? I'm the only person of color in my C-suite. I have, throughout my career, often been the only person of color or only woman in the room. And it really is something that impacts, you really have to fight through sometimes to recognize that you deserve to be there, and you have a seat at the table, and you should have that seat at the table. So, part of my goal is to make sure that I can be that visual for people around me.
I so appreciate that, and I want to love the direction you were going, Ubaldo, with this, Neena. So, kind of combining all the conversation now, especially with what your organization is doing with the pandemic. And you used a really key word there, is like you have to be super intentional about designing a system that is supportive to your patients, to your clients. And I think in the same vein, you have to, with that lens, also then, can you learn from that experience, from this experience that you're going through right now, and bring some of that very intentional design aspects to your very intentional. And that's why we have the our podcast is Choose Inclusion, because you have to choose that. So can you bring some of that internally and learn from what you're doing with the pandemic to maybe augment or maybe even enhance what you're currently doing?
Yeah. So two things there, Mike, for me. It has to be intentional. It has to be integrated into the business and what you do every day. It can't just sit off to the side, right? It can't just be the feel good stuff, that maybe historically, whether it's diversity and inclusion programs, have been, kind of sitting off to the side, maybe in an HR organization, or social impact initiatives that are just really kind of a corporate giving program, again, sitting off to the side. It has to be front and center and integral into how we view our business. And so we at Jazz have adopted a shared value approach to our corporate social responsibility and social impact, corporate responsibility, and social impact initiatives and programs. We very much are doing the same with DE&I. And so we're really asking ourselves, where can we very intentionally focus that has an impact in society, and on the DE&I front, but also has the ability to help support us and drive our business, and to be responsive and meet the expectations of all the stakeholders around us, patients, employees, of course, shareholders, and our communities. And so it really is about strategy, and really integrating everything that you do into the overall corporate strategy. Our purpose as a company at Jazz is very simply put, we're about innovation, and it's to transform the lives of patients. And so everything that we do must and should ladder up to that. And we define patients as all patients, right? It's not okay just for it to be some patients. And so we really are trying to make it part of what we do every day, and that it is kind of the North Star that guides all of our employees, and that it's very clear that that's what we're trying to do. And so when you think about how do you develop in our world products, treatments for patients, really asking yourselves, how do you do that in a way that's responsive to all patients? And so we're starting, we're kind of on that journey, Mike. So we're starting to do that more and more, and I'm really hopeful that it will become just part of what we do and how we do it going forward.
I love it. And I just a quick comment. I don't know if I've ever, and Neena, co-host Neena and Ubaldo, I don't know if any of our guests have been general counsel and leading the DE&I charge for any organization we've ever talked to. That seems like a first to me.
It is. It absolutely is. And I want to do a follow-up question, Neena, to that. How do you go about pushing the leadership team to change their lens on how they approach this, to take it out of it just being an HR initiative and it being integrated? What's been your successful tactics in getting the leadership team to get on board with that kind of thinking?
Yeah, so I have to start by saying I have a great partner on the DE&I, and that's my chief HR officer at the company, Heidi Manna. So I have to at least give her a shout out and say that we are partners, and she's doing a lot of the great work with her team on the HR side as well. So I want to start with that. But how do you get buy-in? And for me, it's about champions, right? It's not just about we're aligned and we're supportive, but that there are champions across the organization and within the leadership. So being in in the sector that I'm in, data speaks, right? So we're all about scientific data. And so that's what I found to be very impactful and to help us be successful in getting folks both on board and committed and ultimately serving as a champion for us. And so really, of course, I don't have to tell this group about the data that exists to demonstrate that truly diverse, equitable, and inclusive environments in corporate settings drive business results. It's just there. The data is compelling and it's obvious. And for those of us who have had the benefit of working in truly, diverse and inclusive environments, we know that, right? We can see it. We know what happens in a room when you get a diverse set of perspectives. It's explosive. It's exciting. So that's where I start. And then it really is about, the storytelling and really giving people a sense of the impact that we can have at a very personal level. For me, ultimately, it's about, what makes me feel good at the end of the day is having an impact on individuals. It really is at that very personal level. And so being able to share with people the impact that we can have, again, whether it's with a patient or an employee or someone in our community based on the work that we do.
Oh, I think those are two amazing tactics to make that happen. And I hope a lot of our listeners take that away as kind of action items that they can really think about on how they can push their own leadership to make that happen.
And so how, I guess, one thing, social impact is a big thing, right? That I think a lot of people, especially right now, it feels like we're all trying to impact a bigger picture. How do you balance that with, well, being it a for-profit, but just, how, like how do you, because that's a hard concept, right? And it's some people define it differently than others, but I really feel like the way we're going to see true change is if more and more organizations shift their focus to impact society in a much bigger way than just what they're selling.
Yeah. Well, I think for me, I truly believe and have subscribed to the thinking out there that meeting societal needs and addressing societal issues will allow for-profit entities and organizations to be successful. We can't operate successfully if things around us are broken and not working. You can't maximize value for an organization, in my world, in healthcare, if you don't address what are the elements of our healthcare system that need to be addressed. I believe that. I really do. I mean, again, it's just something that I think has gained a lot more attention right now, and we have large shareholders, right? We have the BlackRocks of the world and others talking about this, really talking about long-term sustainability of for-profit companies require us to be part of the solution when it comes to some of the societal challenges that we have. And, for me, it's obvious, given that I've committed my career to working in healthcare, that it is part of, how we have to approach our work. And so, when you have a product that treats a particular condition, to really understand the ecosystem in which we're operating is so important. From the social impact perspective, ensuring that you can provide broad access to a therapy is really critical and important. And there's going to be different ways that you approach doing that depending on the circumstances. But you can imagine that if you allow for broad access to a therapy, that will breed success for us as a business as well. And I don't just mean financial, but I mean impact, right? Because we measure our impact based not only on the financials that we have to report on a quarterly basis, but also on the patients that we serve, and we track that information. And so, you really do have to have a starting point of curiosity on how you can do that. But I think companies that are successful with regard to making impact in society will, in fact, also be successful, from a business and a financial perspective.
Yeah, and I think we would all agree on that point. Absolutely, right, Mike?
That's where I was jumping in, Ubaldo.
But I will.
Yeah,
well, go ahead, Mike. Yeah, sorry.
I'm sorry, Ubaldo. Neena, my hope is that this message gets heard by all 500 of the Fortune 500 companies. What a wonderful message that is. Thank you for saying that.
Well, and what I was going to say, I mean, the hard thing is, of course, and you talked about data, but the hard thing is convincing everybody, right, especially on the leadership team, that that's the way to go. And because a lot of leadership teams, right, like unless it positively impacts the bottom line and they have proof of that, it's hard for them to all make that decision. And you need everybody to all make that decision. And so besides data, like what are the conversations that you all are having to get the leadership team on board with that tactic, with that strategy?
Yeah, I mean, it is about really appealing to individuals, and like I said, in the healthcare sector, it's very rare that you don't run across people that have a personal story or connection to the work that they do. We have an oncology business, and I've worked in the oncology space a few times in my career. And you will be amazed at the number of people that are drawn to this work because of a family member or a friend or personal impact that they've had from someone that's been impacted by cancer. Similarly with rare disease. We have rare disease products, and those are products that affect very small populations, but can have really tremendous impacts on those individuals. Oftentimes, it's kids. These are pediatric conditions that kids are born with. A lot of families are actually behind biotech or pharmaceutical companies that start to develop treatments or cures for rare diseases because of the passion that they have for helping their own child. And so you appeal to that to me, right? I mean, that's really, and it's there. And I'm surrounded by colleagues every day that have stories that are so compelling about why they're in this business. And so there is an element of humanity there where we want to do good, and to be able to do good for all folks is important. But for me, it goes back to that environment you're creating from a diversity perspective, because you want to make sure that you have folks around the table and in the room who have such a diverse set of perspectives and experiences that ensure that we aren't leaving part or sector of the community out. So that is really important. It's you want to appeal to people as individuals, but you want to have those diverse backgrounds and perspectives in order to ensure that we're really being holistic in our approach.
That's amazing. I absolutely love that. So Neena, I hate to close us out, but this has been an amazing conversation. I think you've given us so much great advice on what leaders can really aim for. What's the North Star they can aim for? And I hope that people come back, listen to this podcast multiple times, and actually use this as a way to bring this podcast to their leadership, to actually start these conversations. So just want to thank you again for joining us on the podcast today.
Well, thank you all. It's been a real pleasure, and just so appreciate and commend the work that you do as well to create this great dialogue and to allow all of us to learn from each other. So thank you.
And thank you to Mike and Yubi as usual. Thank you guys.
Thank you, Neena. Neena, co-host. Neena, guest speaker. I'm so thrilled. Like, I actually, like, I feel like I know it's like to have a GC, a general counsel of a publicly traded company, be part of this conversation. I just think brings so much. Like, it brings leverage to the conversation. I am so thrilled about today. So thank you, Neena, for joining us. I really appreciate it.
Thank you, Mike.
All right.
Yeah,
Well,
thank you.
thanks for everyone for joining us on the podcast today. Just keep listening to us. If you want to continue to hear great leaders like Neena talk about how organizations can build more inclusive environments, continue to build social impact and social responsibility, corporate social responsibility into your organizations, and we will see you next time.
Bye, everybody.
Take care, guys.
Thanks for listening to the Choose Inclusion podcast. Make sure to subscribe to us on Apple Podcasts and Spotify. And you can see closed captioning for this podcast on our YouTube channel. You can find us online on our website, chooseinclusion.com, and contact us on Twitter @chooseinclusion.